Sophie, and today I'll be talking a little bit about one of the most educational pieces of feedback that I've received during my early practice. So, in my early practice, I placed significant value on the approaches that I've learned from my past training. I wanted to be client-centered as much as possible. So I really try to utilize active listening skills and Socratic questioning techniques, which can usually be helpful in clinical settings. However, I quickly began noticing difficulties when I started working more with clients who had different neurological and cognitive profiles, such as neurodivergent clients and clients with trauma from various trauma backgrounds. When working with these populations, I noticed that I was maybe overusing active listening skills without necessarily balancing it with more directive approaches. And I realized this sometimes limited therapeutic progress in sessions. For instance, some clients would become overly focused on specific topics or struggle to stay on track due to cognitive circumstantiality. Simultaneously, Socratic questioning techniques also became inefficacious at times. As I was working with clients who had attention or intellectual or memory-based difficulties, these clients really struggled to keep up with the sequential steps of Socratic questioning. And so often at times, these conversations fell apart and really struggled to bring that intended therapeutic insight for the client. Even though these techniques remain still valuable in other contexts, I realized that I probably had to do something differently here. For this reason, I went into supervision. And in supervision, my supervisor gave me feedback. She emphasized that client-centered care does not mean using a normative, generalized approach to all client populations, but rather good practice involves being aware and adapting to the idiographic needs of each individual, even if that means that we need to interject sometimes. She also asked me to reflect on my own discomfort with redirecting clients and to explore any distorted beliefs I may have about this process. And I quickly realized that my reluctance was also precipitated by my own worries about coming across as uncaring or harsh if I had interjected clients. And it turned out I was choosing to do what felt easier for me rather than what was needed for the client. So building on this feedback, I came back and I did things differently. My clients and we did some joint case conceptualization work together. We discussed the 4 Ps, how they related to each other, and this was helpful for the client to be able to derive clear long-term goals for themselves, to identify what they really wanted out of therapy. And then at the start of each session, I worked with clients to write down an agenda for that session, a SMART goal, by breaking down one of the previous long-term goals that we've identified. In session and during conversations, I also try to be more transparent and authentic. I use process comments at times to gently nudge conversations. Sometimes I would say, hey, I'm noticing you're passionate about this topic, and I just wanted to check in to see if you would still like to focus on today's agenda. These comments allowed us to refocus without disregarding the client's experiences and preferences. And lastly, with clients who really struggled more with social cues, we made up some physical gestures together that we agreed upon earlier. We decided that we may raise a hand to indicate if someone wanted to interject, or point one finger up to the sky to signal that we might be going off track a little bit here. This helped to maintain structure in sessions and also generally helped with conversational turn-taking overall. Now, it felt like after these adjustments, clients became more engaged because they understood the purpose of our work together better. And for the first time in a really long time, I actually felt like the clients and we were working together as a team against the problems, rather than me feeling like I'm constantly fighting for a chance to speak in session. So this feedback was not only helpful in modifying my behavior and my actual practice, but also it reinforced the idea that an ideal clinician balances gentleness with firmness, and both are equally as important as the other. And that an ideal clinician is able to adapt flexibly to the unique needs of that client rather than trying to apply textbook learnings to every client out there when it doesn't fit. And so that was my feedback story. I hope it was interesting, and thank you for listening.